Good afternoon. My name is Clare York. I'm a physician assistant here at Steele Memorial Clinic. I work in the walk-in clinic, so we see quite a bit of flu every year. My talk today is on influenza prevention and treatment. I don't know what just happened there. Okay, so this talk is going to be about seasonal influenza. Okay, seasonal influenza it's generally what we call the flu. It's an acute respiratory illness caused by influenza A or B viruses that occur in outbreaks and epidemics worldwide, mainly during the fall and winter. Seasonal influenza is in comparison to pandemic influenza. So we're not going to be talking about pandemic influenza, except that I do have 2 slides on pandemic influenza because I think it's fascinating. So, pandemic influenza, this is when there's a pandemic, meaning a global outbreak of a new influenza A virus that is very different from current and recently circulating seasonal influenza A. Pandemics happen when a new influenza A virus emerges, which is, it infects people easily and spreads from person to person in an efficient and sustained way. So it spreads all around the world very rapidly. The most famous pandemic is probably the Spanish flu, which was the pandemic of 1918. In this pandemic, it was caused by an H1N1 virus of avian origin. And we're going to talk about how we define those viruses a little better, but in a minute. It's estimated that during that pandemic, about 500 million people worldwide, or 1/3 of the world's population, because the population was much less back then, became infected with this virus, and there were 50 million deaths worldwide. So that meant 1 in 10 people perished from this flu. So it was a really big deal. Since the Spanish flu, there have been 3 other pandemics. There was a pandemic in the 57-58 flu season. It was an H3N2 virus. They called it the Asian flu. It was of avian origin, meaning it came from birds, and 1.1 million deaths worldwide. In 1968, there was another pandemic. It was again an H3N2 virus, avian origin, 1 million deaths. And in 2009, so we may remember this, there was an H1N1 pandemic. The interesting thing about this pandemic is this influenza A virus had never been seen in animals or people. It was a brand new virus. And there were 364,000 deaths worldwide. Okay, so we're going to go back to talking about seasonal influenza. So one thing I thought we would go over is just talking about what is a virus. So influenza is caused by a virus. A virus is a microscopic parasite which can infect living organisms and cause disease. It can make copies of itself inside the cells of another organism. Viruses are very tiny. They consist of nucleic acid, either RNA or DNA, and a protein coat. That's all they have. Influenza viruses are RNA viruses. And one of the best ways, I think, to describe what viruses are is to compare them to what bacteria are. So bacteria are tiny. You need a microscope to see them. And in comparison, viruses are tinier. The largest virus is still smaller than the smallest bacteria, so they're really tiny. Bacteria are complex single-celled creatures, and like we just talked about, viruses, all they are is a little bit of genetic protein with a little bit of genetic material with a protein core. Bacteria can reproduce on their own, but viruses, they cannot survive or reproduce without living inside of a host cell. And most bacteria are harmless. In fact, there are lots of helpful bacteria, like we've been hearing a lot about gut bacteria. Less than 1% of bacteria cause disease in people. And in comparison, most viruses do cause disease. And the ones that we think of most commonly are cold viruses and flu viruses. Okay, so now we're going to talk about influenza A and influenza B. So as we said, during seasonal flu outbreaks, there are circulating viruses that are either A or B. So influenza A viruses, these can spread in humans and animals. So we hear about bird flu, we hear about swine flu. Influenza B viruses spread almost exclusively in humans. As we talked about, the A viruses can cause pandemics, and B viruses are not a pandemic threat. So they're responsible for seasonal flu. And this is just, you hear the H1N1, the H3N2, this is just how we come up with those names. So the influenza A viruses are described by their surface proteins. So the H's, it's hemagglutinin, it's a protein on the surface, and the N's are neuraminidase. So that's where we come up with that name. And then the B viruses are broken down by lineages, for example, Yamagata, Victoria, but most of the time we don't really need to worry too much about that. Okay, so let's just say it's flu season, and I've got the flu, and how am I gonna spread it to people? Okay, so influenza spreads from person to person, and I, if I'm sick with the flu, can spread it to people who are within 6 feet of me by coughing, sneezing, or talking. And what happens is these little droplets come out of my mouth, and they can land in the mouths or noses or be inhaled into the lungs of people nearby, and that's how other people get the flu. Less commonly, people get the flu by touching virus particles and then touching their own nose or mouth or possibly their eyes. Okay, so that's how it spreads. And so when is influenza contagious? So I've got the flu, when am I able to spread it to other people? So I am going to be most contagious during the first 3 to 4 days after the illness begins. It is possible for me to spread the virus for up to a day before I start having symptoms. So I could be shedding virus and I don't even know I have the flu yet. And it's also possible to shed virus for 5 to 7 days after you get the flu. Some people, especially young children or people with weak immune systems, can spread it for even longer than that. But generally speaking, it's most contagious during the first 3 to 4 days. Okay, so I have the flu, I coughed on you, a droplet landed in your mouth, and now you're gonna get the flu, so what's the incubation period? So how many days is it gonna take for you to start feeling sick? So the incubation period is 1 to 4 days. So it's gonna take an average of 2 days for you to get the flu. And this is about transmission. So this basically is how contagious in it. And I was able to find one small study where they infected people with the flu and then put them in a room for 30 hours with people who didn't have the flu with just casual social contact. They were, there wasn't close physical contact. And 1 in 4, so 25%, 1 in 4 of those people got the flu. So I guess the way I was thinking of it is, so you're at the grocery store, the checker has the flu, he's coughing, he's sneezing, he's talking, he's touching all of your stuff. 4 people go through the line, 1 of them's probably gonna get the flu. Okay? All right. So now I've given you the flu, so what kind of symptoms can you expect? So flu starts with abrupt onset of symptoms in comparison to colds, which have a gradual onset. So when you have abrupt onset of symptoms, that's kind of a hallmark of the flu. People will have fevers or feeling feverish or having chills, and usually their temperature will be between 100 and 104. We've seen some people can have temperatures up to 106, especially in kids. Yeah. Usually a dry hacking cough, sore throat, runny or stuffy nose, headaches, fatigue. But the biggest thing is the muscle or body aches. People cannot believe how bad their body aches are. And people come in and they literally think they're dying, and then you tell them that they've got the flu and they just can't believe it. They can't believe how bad they feel. The body aches are really bad. It's important to note that not everybody who has the flu will have a fever. Oh, and some people can have vomiting and diarrhea, but that's not typical. Vomiting and diarrhea can occur about 10 to 20% of the time, mostly in kids, but that's not typical. All right. So I thought it would be important to talk about what flu is not. Flu is not a cold. Colds are also caused by viruses, and they're also really common in the fall and winter. But colds come on gradually as compared to that abrupt onset when you have the flu. Fevers and aches are less common and milder. Chills are uncommon with the cold. People will have lots of sneezing, stuffy nose, sore throat. So the biggest difference with a cold, I think, is that gradual onset of symptoms. People will generally describe that it started with a sore, scratchy throat, and then the next day they got kind of a stuffy, runny nose, and then the next day maybe they started coughing. With the flu, it comes on all at once. In fact, people can pinpoint exactly when it started. They'll say, I was at work on Tuesday, it was 3 o'clock, and I got a fever and body aches and a sore throat, and I started coughing. They can really pinpoint exactly when it started. Influenza is also not the stomach flu. So stomach flu is gastroenteritis. We really shouldn't even call it stomach flu. But gastroenteritis is often caused by a virus, and gastroenteritis causes nausea, vomiting, diarrhea, crampy abdominal pain. Sometimes people will have low-grade fevers and body aches, but it's very different from influenza. Okay, so now I've given you the flu. How long are you going to be sick? So patients with uncomplicated influenza, and we're going to talk about complicated influenza next, but uncomplicated influenza usually start to feel better after about 2 to 5 days. Sometimes people feel bad for about a week. Some people can have persistent weakness and fatigue that can last for weeks after they have the flu. Okay, but generally speaking, it's going to last less than a week. Okay, so what is complicated influenza? This is where you didn't get better in a week, you got sicker actually. So some moderate complications are sinus infections or ear infections, but more serious complications are pneumonia, inflammation of inflammation of the heart, the brain, or the muscles, and recent research has linked influenza with heart attacks. Yeah, so there could be very serious complications from influenza. Okay, so some people are at higher risk for complicated influenza, and this is a very busy slide, but it kind of goes through who is at risk to get very sick when they get the flu. So children younger than 2, adults 65 and older, people with chronic lung, heart, kidney, liver, or blood disorders, people with metabolic disorders, including diabetes, are at higher risk from getting very sick with the flu. And people with neurological or neurodevelopmental conditions. Also people who are immune suppressed. So people who are on chemotherapy or have had an organ transplant and are on immune suppressive medications, or people with HIV, they're at higher risk. Pregnant women or people who have had a baby within 2 weeks are at higher risk from getting very sick from the flu. People who are younger than 19 who are receiving long-term aspirin therapy. American Indian and Alaska Natives are at higher risk. And then people who are morbidly obese, so with a body mass index of 40 or higher, are at higher risk from getting really sick. And then residents of nursing homes or chronic care facilities. Okay, so I've given you the flu, you feel really bad, so you come to the clinic. Okay, am I going to give you a flu test? Most likely no. If you're very, very sick and we're going to put you in the hospital and give you antiviral medications, then you're going to get tested for the flu. But if you come to the clinic and you sound like you have the flu, so your symptoms are consistent with the flu, we'll probably not even test you, and we might give you antiviral medications. If we just don't know, well, is this the flu? I'm not really sure, then we might give you a flu test, but generally we don't need a flu test to make a diagnosis of the flu. Okay, so if we are going to test you for the flu, how are we going to do that? Well, we used to have this rapid influenza diagnostic test. That one was a little bit less accurate, so now what we have is this rapid molecular assay. So this test actually detects the genetic material that's in the flu virus. It takes about 15 to 20 minutes to do. It's more accurate than the old tests. And I got the cash price. I think I called the lab and got the cash price, and it's $120 here. But you know, your insurance might pay for it. You just have to ask them. Okay, so I gave you the flu, you came to the clinic, we're pretty sure you have the flu, or we tested you for the flu and it's positive. Am I gonna give you antiviral drugs? So let's talk about antiviral drugs. So first of all, they're prescription. They can be used to both treat and prevent the flu. Studies show that early antiviral treatment can lessen the symptoms and shorten the duration of your illness by about 1 to 2 days. So not like an antibiotic where it starts killing the bacteria. So antibiotics are used for bacterial infections. Antiviral medications work by slowing down viral replication. So all they really do is shorten the severity of the illness and make your symptoms lessen the severity and shorten the duration, okay? The antiviral medications should be started as soon as possible after making a diagnosis of the flu, preferably within the first 48 hours. But we may start them after the first 48 hours if you have very severe disease, complicated or progressive illness, or you're in the hospital. Then we might say, well, it's been past the 48 hours, but we're going to treat you anyway. Okay, so who really needs treatment? So antiviral treatment is recommended for hospitalized patients, people with severe, complicated, or progressive illness, or if you're at high risk for influenza complications. But we can also give antiviral medications to healthy, symptomatic patients who are not at high risk for complications. And we have confirmed or suspected flu on the basis of clinical judgment if we can start them within the first 48 hours. So if it's past the 48 hours, we're really not going to give you antiviral medications. But if it's within the 48 hours and you really want to take the medication to lessen the severity and shorten the duration of your illness, we can do that. Okay, so there are 4 different medications that are approved by the FDA to treat flu. The one that we use the most and that probably everybody's heard of is Tamiflu. We can give it to people 14 days and older. For treatment of the flu, it's twice a day for 5 days. If we're using it to prevent the flu, and I have a slide on prevention in a second here, then it's once a day for 10 days. Adverse events, people can have nausea, vomiting, headache, and the cash price for that medication is about $50. You've probably seen the commercials for Influenza, which is an inhaled antiviral medication. It's for 7 years and older. Treatment is twice a day for 5 days. Prevention is once a day for 7 days. Adverse events are bronchospasm, which is spasm of the airways, especially if you have underlying airway disease, sinusitis or dizziness, and that one's $70. This one, I don't even know if we have this here. I've never prescribed it, but it's a 1-dose IV medication used for influenza, and it's $1,000. Yeah. And this one was approved a year ago. This is a 1-dose oral medication. It actually works a little bit differently. These other 3 are neuraminidase inhibitors, and this one is, I don't remember the mechanism, but it works differently. And it's $160. Ashley, have you prescribed Zofluza? Mm-mm. Yeah, they just approved it a year ago. Expensive. It's $160, yeah. Okay, so you're probably all thinking, oh wait, so this is my slide on preventing flu. So the antivirals are 70 to 90% effective in preventing flu. So we can give these medications to people to prevent flu in certain situations. So if there's an institutional outbreak, we may prescribe these medications. If a high-risk patient is exposed to somebody with the flu, we might give it to them as well. Okay, but because the dosing for prevention is once a day for 10 days, if we are treating a patient to prevent the flu and they develop flu symptoms, they need to let us know, because then we change the dosing. Yeah, then you take it twice a day for 5 days. Okay, so you're probably all thinking, flu just sounds awful. How can I prevent myself from getting the flu in the first place? So this is just kind of some common sense stuff. You want to avoid close contact with people who are sick. Stay home when you are sick. Keep your mouth and nose covered, lots of hand washing. Try to avoid touching your eyes, nose, or mouth, and then practice other good health habits. So cleaning and disinfecting surfaces at home, work, or school, getting plenty of sleep, being physically active, managing stress, drinking plenty of fluids, eating nutritious foods, just keeping your body healthy can go a long way to help prevent you from getting sick. The single most effective way to prevent getting the flu is to get an annual flu vaccine. Okay, so this slide is just kind of some terminology, because this can be really confusing. So this just kind of explains what some of these words mean when we're talking about flu vaccines. So a trivalent flu vaccine, all that means is that it protects against 3 different flu viruses. So it protects against an H1N1, an H3N2, and a B virus. Okay. And a quadrivalent flu vaccine protects against 4 different flu viruses, an H1N1, an H3N2, and 2 B viruses. Okay. You've also probably heard of the high-dose flu vaccine. So that one is a trivalent, so it's going to protect against 3 different flu strains. It has 4 times the amount of antigen in a regular flu shot. And then there's an adjuvanted flu vaccine. It's also trivalent. So this one is formulated with an ingredient that helps create a stronger immune response. And then there are live attenuated vaccines. And these are formulated with a weakened live virus. Okay, so I put 3 slides in here talking about which vaccines are available in Salmon, Idaho this year. Because this is a small town, I was able to do this. So here at Steele Memorial, we have the Fluzone High Dose. It's $75. It's a trivalent vaccine, so 3 strains. This one is approved for people ages 65 and up. It offers greater protection against the flu. Studies have shown that older people don't mount as strong of an immune response as younger people when they get a flu vaccine. So the higher dose helps them mount a greater immune response. It does have a higher risk of non-serious injection site reactions like redness and pain at the injection site. We here at the clinic also have Fluvaval quadrivalent, and it's my understanding that this is supplied by the state, and it's free for kids 6 months to 18 years through the clinic. And then we've got the Flucelvax quadrivalent. It's $43. It's approved for people aged 4 and up. It's cell cultured, meaning it's grown in cells and not eggs. And this is probably the one that we're all gonna get this year, I think. Okay, at Safeway, they've got the Fluzone High Dose. Theirs is $59.99, same as our high dose here. They've got Fluad, which is an adjuvanted vaccine. So remember, it has an extra ingredient formulated to help mount a stronger immune response. It's for people aged 65 and up. Again, higher risk of non-serious injection site reactions. And then they have Fluarix quadrivalent, which is $26.99, age 6 months and up. And then the health department, they have a lot of different choices, and I wasn't really able to get their prices. They kind of said it depends on insurance, and they weren't very clear. They said, that people just have to come up and see. But they also have the Fluzone High Dose. It's $82 up there. They've got the Fluvaval quadrivalent, age 6 months and up. Their state supplied vaccine is the Flucelvax. And for uninsured adults, it's $20. Otherwise, it's $32. They've got Fluarix. And they also have this Flu Mist quadrivalent. The Flu Mist is the nasal spray vaccine. So I actually made a whole slide about it because this one's a little different. So you may remember the first thing that my first response when I heard that Flu Mist was going to be available again this year is, well, wait a minute, it wasn't available last year or the year before, I think, because they said it was less effective. So what they've done is they've made a new formula. It's more effective against H1N1, so they put it back on the market. This is a live attenuated vaccine. So remember, it's made from weakened live virus. It's quadrivalent, and you spray it up your nose. Approved for ages 2 to 49. Because this is a live attenuated virus, we need to use it in healthy, non-pregnant patients. We want to avoid it in children ages 2 to 4 with a history of asthma or a history of wheezing in the past 12 months, and we cannot give it to people who have contraindications to live vaccines, which is chronic disease, immunosuppression, or if they're around severely immunocompromised contacts. So it seems to me that the flu mist is really only going to be for really healthy children and adults who are just petrified of needles. Yeah, so this one's available at the health department. So who needs a flu vaccine? So it's recommended that everybody 6 months of age or older have a flu vaccine every year unless they have a contraindication. And there really are not many contraindications to flu vaccine. So if you've had a bad reaction from a previous flu vaccine, or if you're allergic to any of the components in the flu vaccine, then you probably shouldn't get one. Special consideration for people with egg allergies. If you are allergic to eggs and have a severe reaction, like anaphylaxis, then it's recommended that you have the vaccine in a medical setting where you can be monitored. If you have a mild reaction to eggs, just hives or something, they're saying that you can still get one. Okay, when should I get the flu vaccine? So the CDC recommends getting the flu vaccine by late October. It takes about 2 weeks to build immunity. If you didn't get your flu shot in October or November or December, and now it's January or February and we're in the height of flu season and you want to get a flu vaccine, that's fine. You can get a flu vaccine as long as there is active influenza circulating. Little kids who have not had 2 doses of flu vaccine, they might want to start earlier because they have to have 2 flu shots 4 weeks apart. So we want to make sure that they have immunity before the end of October. Okay, and so this slide, I can't take credit for. Craig actually pulled this data.
We've got it.
So this just kind of goes through flu season here in Salmon, Idaho. So last year, the first case was December 27th, and the last case was May 4th. The year before, first case December 14th, last case March 27th. The year before, it started kind of earlier. So for the 2016-2017 flu season, the first case was November 4th, and the last case was March 16th. The year before, first case February 11th, last case May 3rd, and in 14-15, first case was November 11th, and last case was February 26th. So our flu season is kind of November through May. So me personally, since I'm probably going to see a lot of flu patients in the walk-in clinic, I'm going to shoot for getting my flu vaccine right around the middle of October, and that way I'll have immunity built up by the beginning of November, which is historically when we started seeing flu. And then they do think that immunity can start to wane, so hopefully I'll be protected all the way through May. Okay, so is the flu vaccine effective? The answer to that is yes and no. So apparently it's very difficult. So these scientists get together and they look at the circulating strains in the southern hemisphere during their flu season and start making our flu vaccines based on what is circulating. And sometimes there's a very good match and sometimes not so good. There's something called antigenic drift and antigenic shift, where the antigens on the flu viruses can actually change, and then unfortunately sometimes our flu vaccine is not as effective. Last year, those numbers didn't come out very well. Let me just find my slide in there. So last year, the flu vaccine was only 29% effective. But here in 2010, 2011, it was 60% effective. The worst looks like it was in 04, 05, it was only 10% effective. So sometimes it's very well matched and sometimes it's not. But flu vaccination reduces the risk of flu illness by between 40 and 60% among the overall population during seasons when most circulating flu viruses are well matched to the flu vaccine. And flu vaccination has been shown in several studies to reduce the severity of illness in people who get vaccinated, even if they end up getting the flu. They're gonna be less sick, so that's an advantage. And getting yourself vaccinated can help protect those around you, young kids, older adults, people who are immune compromised. And so, why do we care about the flu? So the disease burden of flu is actually pretty significant. So annually since 2010, the Centers for Disease Control estimates that influenza results in between 9.3 million and 49 million illnesses. So people who are sick for a week, they miss work, and between 140,000 and 960,000 hospitalizations, so those are people who had to go to the hospital, and between 12,000 and 79,000 deaths. And this is looking at last year. Last year was actually pretty bad. Whoa, sorry, hold on. Last year was actually pretty bad. We had 49 million illnesses, almost 1 million hospitalizations, and 79,000 deaths from the flu.
That's worldwide?
No, this is in the US.
Oh, in the US.
Yeah.
Wow.
And sadly, there's already, so they keep really good track of pediatric deaths, and there's already been one pediatric death. It was in the middle of September this year, in the middle of September in Southern California, a 4-year-old. She, it sounds like it was, she had some underlying health problems. But we've already had one pediatric death this year from the flu. Oh, and this is just kind of a fun little infographic. So this is last year, just kind of talks about, or just shows you how it just spreads like wildfire once it gets started. Okay, so this, so the little stripy parts are no activity. This is sporadic activity. The yellow's low flu activity, regional activity, and then the dark brown is widespread. And then if you watch up here, it'll tell you when we're looking at. So you can see here at the beginning of flu season, you know, there was sporadic activity, then we started seeing some more local activity, then we got some regional activity, then we started seeing some widespread activity in a few states, and then by the middle, so now we're in December. So in January, we've got lots of widespread activity.
Wow.
And then by February, it is everywhere except wide.